So, are you guys ready?
Ready.
Yeah, let's listen. Let's do this. So, welcome everybody. We got together this week as our first round of videos with Mitigate Partners. So, I'm joined by a couple of friends, which we'll get introduced here in just a second. But we are starting a series that we want to bring you some simple ideas to help regain some of the costs and regain some of the money in your health plan. So, Carl and I did a series last year, and we've got Christy on here as well. He's been a big part of just some of the collaboration around the country. But our goals are ultimately to integrate, educate, and mitigate your spend on your healthcare. And Carl and our series last year was around demystifying healthcare costs. So we want to take one component and share some insight on that today. So let's start with some introductions. So Carl, I know the entire world knows who you are, but do you want to touch on just real quickly where you are and kind of where you fit for just a second?
Yeah, I'm in the middle of the woods in middle Georgia, if you can tell with my facial hair. No, I live in Atlanta, Georgia.
Yeah, that I didn't know if we were going to address that thing that's attached to your chin there. I've never seen that on you, but looks great. I don't know that it blends with your pink coat, but I don't know that it doesn't either. So who am I to judge? I'm just jealous because I can't grow that kind of facial hair. So Christy,
definitely forgot that it's not wintertime anymore. It's springtime, man.
Yeah, absolutely. The pink, right? It's Derby. Derby's coming up, so that's what it is. So, Christy, where are you located in the country? Mitigate Partners that come from everywhere, but where are you located?
So I'm in the Carolinas. I'm really nicely located so that I can toggle back and forth between both North and South Carolina. I'm in the western part of North Carolina, but the South Carolina border is only 45 miles away from me, so I can go back and forth between both of the Carolinas.
All right, perfect. Well, those of you that don't know me know may not know that I am actually a Kentucky boy, but we relocated, brought the family to Tampa, Florida 4 or 5 years ago, and I don't see me going back to Kentucky anytime soon. I love my home state, but we love Florida better, so we got perfect weather today. We're going to talk a little bit more about Mitigate Partners in a minute, so I'm going to move on to the subject that most people that are listening are going to want to hear about. So we ultimately are right in the middle of this pandemic. So Carl had made a couple of points that I thought were really important. So we brought this group together to talk about how our clients specifically pandemic and crisis-proof their health plan. So Carl, you've got one of the best examples I've heard so far, because here in Florida, we are a big tourism state, and you've got a great client that's in the hospitality space. Talk to us a little bit about what has gone on with them during this pandemic and why this is so important.
Sure. I think, Dennis, is probably about 4 years ago, we kind of started down this path of really what we call employer-billed healthcare for them. Instead of letting the insurance company control their plan, we took it in their own hands and really built it brick by brick. And the result was about $3.8 million in savings over a 4-year period versus if they had become self-funded with Blue Cross, United, Cigna, and Humana. So because of that, they had a good bit of money in reserves, and so far they have not had to lay off anybody in the hotel business, which is unheard of.
All right, so that should make the Good News Network, right? I don't know if you guys have seen that, but that's some good news for employers for certain. So let's talk about some of the dialogue that's in the market right now. This is what kind of started up for me. I started making some calls. Christy, can you talk about what you're hearing is going to happen with healthcare costs amidst all of this? We've got Milliman put a survey out. There's some talking heads. What are you hearing?
It is such a mixed bag. One person says this, another person says that. Milliman, which is a very respected actuarial firm and consulting firm in their own right, says that not only insurance companies but other payers are paying so much less right now that they are building up all kinds of stockpiles of money. But then Cover California or California Care or whatever they call that out there, they predict that fully insured plans are going to go up by 40% in premiums next year. So it's hard to know who exactly knows what they're talking about. But what I personally think is that the employers that are situated today or in the near future with high-performing health plans that are actively managed where they can see the dollars as they're coming in and going out are the ones who are going to be able to fare the best. And so that's what we're here to talk about today.
All right, well, that leads me to great points. So we know there's some pent-up demand coming. We know that people are probably spending less right this second, but we don't have any antidote yet, right? There's no vaccines yet. So there's still a lot of unknowns. So I think I'm kind of with you. I think it's still too soon to tell. But either way, Carl, talk about how employer-built versus insurer-built can make a significant impact on not just this crisis, but any crisis or pandemic.
Sure. What I would say is anyone that currently is working with an insurance company as their insurance carrier or as their third-party administrator is really more, Dennis, in a traditionally passively managed plan, meaning that they're hitting the easy button and they're allowing the insurance company to run their plan and control their costs, et cetera. And we don't have time to go there today, but if you believe that works, then I've got a lot of other things I can sell you today. So anyway, it was one that we called insurer built. It just didn't deliver results. Like we were using the example of the hotel client.
All right. So if you deconstruct it, put it back together. So like this Mr. Potato Head, right? Tell us about this example and why, what does it mean? Explain kind of for those that don't understand kind of the insurance speak that we're in. What do you tell us what's different about this versus the superhero potato heads that are built?
The insurer built plan, as you see, that's what people don't realize. That's really what their Mr. Potato Head looks like. So what we tried to do is literally deconstruct it, unbundle it, rebuild it brick by brick with the best bricks possible in cost containment risk mitigation. And we came up with these really cool superhero-like Mr. Potato Heads that are employer built. They're human employers and employee centric. They're for the employees, benefits done to them. Benefits not done to them, but for them.
All right, that's great. So brick by brick, we've seen this framework, right? So there's a fair cost health plan, which is what got me kind of drawn to some of what you're doing and some of the successes that you're having. But today specifically, we've got one component that we want to hone in on. So when you say brick by brick, is this what you're talking about? These are the components of the fair cost health plan that Mitigate Partners has out there in the market.
Right, and combined, Dennis, as them all put together, there's a chance to save 30 to 40%. In the case of the hotel, it was 67% over 4 years. So yeah, let's talk about just the utilization management component first and how significant that is in the plan.
All right, so this is this is one small piece, right? There's a lot of things we can do to get those 30 to even 67% savings, right? To get to that, you got to have a lot of these plugs in place, but we've seen any one of these could generate 5 to 20% savings depending on how it's built. But the concerns that I'm seeing, guys, are these pieces, right? So as Mitigate Partners, we've looked at this and we've debated it a little bit, and we know demand volume is going to go up probably overnight. There's no way that we do no surgeries for a little while and all of a sudden have nothing happen and no repercussions. What we don't know is exactly what that's going to look like. We also know a lot of these ambulatory surgical centers have laid off some people because they were trying to keep the doors as open as possible. But Florida has reopened just as of Monday. So North Carolina, Christy, did you say they're open yet or not?
To my knowledge, they are still not doing elective surgeries right now, but that's only a couple weeks away from going back to full throttle.
So the longer the delay, the more the demand builds up. The longer the delay, the more those employees are off and may not come back to work. So the concern about how quickly can we ramp up, I think, is a big deal. If we shift people out of these surgical centers that we know have higher quality and lower costs to maybe the local hospital, we've seen the cost potentially could jump up as much as 5 or 10%. And if I'm an employee, I probably don't know that that's even a remote issue or a concern. So educating is going to be a big deal. But ultimately, if we get shifted to lower quality, then people don't come back to work quicker, right? So, and the cost is higher, and they may not fare as well after the surgery is done. So that's the concerns that we've come up with. Do you want to talk a little bit about with every good crisis comes an opportunity, right? So let's talk about what's the opportunity in this.
Sure. It is always front of mind with Mitigate Partners to seize good opportunities and not to miss opportunities. So with this, we have an opportunity to actively manage this risk, this immediate demand for elective surgeries that is going to sort of come back like a flood, we believe.
Yeah.
How do we actively manage this risk? Well, first of all, employees need to know what the risk is. So we need to be in constant contact with employees, educating them and helping them understand that not only is the local big hospital too risky of a place for an elective surgery, but it also could come with higher costs to them. So we need to be looking at showing them the transparency in the costs, using some examples and using some stories to help make that real, not only to the employees, but to the providers that we do business with. We want to talk about paying cash upfront for elective surgeries and how those negotiations can be, 2/3 lower than getting a bill after the fact by having a surgery done in a large health system. And we really ought to consider a plan design adjustment to start with the pre-certification because that is the best way to create that behavior from employees is to go ahead and make the plan operate just slightly differently to incentivize going to these higher quality, lower cost ambulatory surgical centers for elective surgeries. So Carl, you have already kind of done this. Tell us about how this works.
Yeah, before we move on here, Christy, in light of not missing, letting a good crisis or opportunity go by, Christy, you left. You didn't even talk about the cartoon. I mean, me coming from Middle Georgia and be a slow-witted, fat, balding man here.
Hey, easy.
Well,
I'm in the room. Virtually.
I know. Hey, we show movies up here on my forehead, Dennis. Anyway, so what's interesting about this picture is if you're the patient, and today we have all these third parties. That could be insurance companies, pharmacy benefit managers. The doctor's having to work through the insurance company to take care of the patient. And what we've done in this active management opportunities that we've created with fair cost and employer-billed healthcare is we've removed and eliminated the middle. So the doctor can actually take care of the patient unbothered. And we're going to talk about an example about that now, about how we're able to look at claims information and how we have been able to actively take advantage of that to save the client's money.
So for your plans, Carl, you've got a pre-cert procedure already built in place. So tell us, so what does that mean to the average Joe? Like, what did you do with your plan specifically amidst this and this concern?
Right. Dennis, because it's an unbundled approach, we've got what we consider to be the best utilization management organization involved in our fair cost plan. We had contacted them immediately in the last few weeks and said, we need to get a copy of any type of claim or any type of calls you've had where people were getting pre-certed procedures. I'm having an MRI done or whatever it be. They have to call into the pre-cert company. The pre-cert company then accumulates and keeps reports of the calls and what's happening. So this was a list of one of our clients that you can see the bulk of these procedures that are noted on the far right were MRIs and CT scans. As Christy Gupton so eloquently pointed out earlier in an earlier conversation with us, that may be precursors to surgeries. But we now have a great idea of what's going on within the group, so we can actively manage. And if we have a benefits champion on premises, as we do, they can start talking to the employers proactively, not in violation of ERISA at all, but talk to them and see what we can do to get them to the right places at the right quality and lastly, the right price. So that's how we would use that.
So very simply, if you heard all that and you're an employer or an employee and you don't know what that is or how to do any of that, or you don't know if you even have access to that, what's the, I guess, what's the one thing that they should do, Carl?
They ought to call us. And talk to us about it, because if they're not able to get this information, that's a problem. And that's the whole component, Dennis, of active management. And one other quick thing to piggyback on what Christy said about cash price. We have had numerous examples, especially, Dennis, in your home state of Florida, where we've had deliveries. We paid 30 days in advance cash. And right now, folks, cash is king. These hospitals, even though they did get the money and stuff from the PPP, they still are struggling because they're not doing surgeries. It's slowly opening. So now's the time to capitalize. If you do have to go to hospital or an ambulatory surgical, they're willing to do lower prices for cash, the money up front instead of waiting 60 days. So real quickly, we've had a couple of hospital, probably, Dennis, what, about 45 minutes from you, $35,000 for a vaginal birth. $35,000 for a vaginal birth. We've had it done for $7,500 in cash. And we paid 30 days in advance. That's some of the active management principles that can be applied here. But if you don't know what's fixing to happen in your health plan, you really can't do that. And most of these programs, like one of our school district clients, we literally find out the day of when it's already happened. We had a heart transplant recently, a few weeks ago, $3.2 million claim. It was paid out at $1.6 million. We didn't know anything about it. It was a heart transplant. So had we worked in our framework, we would have known before the claim became a claim.
So that's the big difference between doing active management and passive management. So most of Florida, we know 85% is probably in a passive management arrangement, and they wonder why costs keep going up. So I always like to wrap up. We're a little over our time frame. So I want to wrap up with kind of the cost of doing nothing. I always look at this and say, okay, what if all of that means nothing to me or I do nothing about it? So I see that we're going to increase the spend for our employees and the employers. And right now, I think every dollar matters, right? I believe you guys would agree with that. So we don't need to spend more than necessary, right? We certainly don't have to save money and risk quality, but in this scenario, you're improving the quality and saving money, which is a win-win. Lower quality typically means higher costs, and for an employer, slower return to work for those employees, which is not good for anybody. Missed opportunities to help educate employees on just tools, that these tools and the value of going to the ambulatory center versus the big box hospital potentially, and maybe even helping the employees understand that they can control some of what their spend is in the right programs. There's a missed opportunity for that cash flow right now. Like you said, Carl, cash is king. That's what we're hearing everywhere. Everybody's trying to find every penny that they have to keep doors open, and that's another opportunity to improve your cash flow, which we know is critical. And then missed opportunities to gain basically an unfair advantage against your competition. So don't let any good crisis go without taking advantage of the opportunity. So we wanted everybody to know today, if you do nothing, this is what you're at risk of. So at the end of the day, for Mitigate Partners, Carl, what's your vision for this? I think briefly we've talked about pulling people together. Do you want to touch on, just what's your vision for what Mitigate Partners is in the future?
Yeah. Well, Dennis, it really all came about, as you know, since you guys were all initially on the ground floor with it, we were all helping each other in this environment we're in, which is very different. Normally, we would have been competing with each other. And since we were pulling our heads together, we found out 3 heads is better than 1. And so there have been multiple examples of where maybe an advisor in Texas and an advisor in Florida and an advisor in Atlanta, being me, that are all part of Mitigate, can work together, because no one person, no one benefits brokerage shop has the answers. Matter of fact, most of them are very myopic in their view. Dennis,
I'm from Kentucky, right? So I know there's some people besides me, they may not admit it publicly, but I know what myopic means. But help us understand what does myopic mean to the average consumer from their standpoint? If you got an advisor that's got a myopic view, what are they doing differently than Mitigate Partners?
That's a great question, Dennis, and I'm not really far from you where I grew up. So I just thought it sounded cool, actually, but sounded smart, No, it's a very narrow focus, very narrow view. And in a lot of the benefit shops, and all of us, look at your shop. You have a different view of things. Christy has a different view of things than the rest of the people around you. So we thought it'd be best to pull together the best and brightest minds around the country to share these ideas. And that's how we came up with the 19 firms we're working with. And all of us share best practices, best ideas, how we make fair costs better. And it's just always on the cutting edge. And then we try to pair it like you and I have, working with you in Tampa. As we find employer clients in Tampa, we would pair them with you So you manage that and so forth. And that's really what this model is about, having the collaboration, but with local management connections, so we keep everything local.
Well, I appreciate you guys letting me hang out, because I know there's people that argue about me being one of the brightest minds in the industry, but I appreciate you guys letting me hang out with you. And I do believe that benefits have gotten more complex, right? There's no doubt about that. They're probably not going to get any easier. Collaboration, I think, is critical to make sure our clients stay in a good spot. And there is no easy way to manage them. If you can hit the easy button, that's fine, as long as you can afford it, is what I see. If there's plenty of money laying around, it's no big deal. But for those employers that are trying to pay attention to where costs are going, this is the only approach that I see that really, really works. So thank you guys for taking the time today. I appreciate you joining us. Christy, thank you so much. I think the goal is to do a couple of these with some frequency and start getting more of these tools out there to you guys. So please don't hesitate to reach out. Our email addresses are on the screen. We all work nationally. We have advisors around the country, so we'll start inviting some of those guys on as well as we see good ideas come to the table. But this one was hot off the presses, so I felt like it was important that we get it out. So thank you guys very much. Have a great afternoon. And if you haven't already, subscribe to the YouTube channel. Thank you, guys.
Bye, everyone.
Bye.
Thank you.